Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by microbiologist. I hope all of you are well and fine. Today I'm going to explain another lecture that is related to the cancer, or we can say that is related to the tumor marker, and it is about the HCG, or we also call it Beta HCG test. My name is Muhammad Kamil Khan and you guys watching my channel Microbiologist. Let's start the video. First of all, let's introduce that what is HCG. HCG, the full form of HCG is human chorionic gonadotropin. Okay, it is also called Beta HCG as well. Now it is actually the hormone. Okay, HCG is what? It is actually the hormone that is mostly produced in the pregnant woman at that time when the placenta is formed, and it is produced actually by the placenta after or we can say earlier 10 days. Once the egg fertilized and it is converted into the embryo, then at that time the placenta will produce Beta HCG hormone. Now let's see the function, that why this hormone is mostly produced. So the main function of this hormone is to support the early pregnancy stage. Why? Because it can maintain the corpus luteum, and corpus luteum will produce progesterone. So if the corpus luteum produce the progesterone, so progesterone will prevent the menstruation, because once the menstruation is prevented, so then what will happen? It will allow the embryo to grow inside the uterus. Next, this HCG can also stimulate another hormone that is called as estrogen hormone, and due to this estrogen hormone produced from the ovaries and placenta, it can support the growth of the fetus, as well as provide or make some changes in the mother bodies. Next, it can also regulate our immunity to be resist, and due to this way what will happen, it can help the mother baby to accept the fetus. Okay, sometimes the fetus is not accepted, but by the production of HCG the fetus will be accepted, which is genetically distinct from her own. That's why this is the importance of this HCG. So this is the function of the HCG, that why it is produced and why it is important. Let's see the diagnostic purpose of this test. So this test is mostly performed during or we can say early ectopic or molar pregnancy. So this test is specially performed to diagnose, or we can say to check, the early pregnancy, and it is also important to check the ectopic and molar pregnancy. Ectopic pregnancy is the pregnancy in which the egg fertilizes at the fallopian tube. So once it fertilizes at the fallopian tube, an embryo is formed at the fallopian tube. So what will happen? It will cause complication in the pregnancy. Next, we have molar pregnancy. So when the fluid or the some extra fluid are filled in the uterus portion, so we call that molar pregnancy. Okay, this test is also used to diagnose certain types of the cancer like testicular cancer and ovarian tumors. This test is also used to check the fertility treatment monitoring. For example, if there is a fertility issue, so then there will be providing some types of medicine and there will be surgery. So if you wanted to check either the treatment is workable or not, so we perform Beta HCG test. Now let's see the normal range. So in pregnant women, as this test is mostly performed in the women, so in pregnant women the normal range is 5 to 40 IU per liter, international unit per liter. In male, their normal range will be less than 2.5. In non-pregnant women, their normal range will be 5.0, less than 5.0. In post-menopause stage, it is the stage in which the menstrual cycle will be stopped. So and after 1 year the menstrual cycle will again start, so it is that stage. So their normal range will be 9.0 in case of the post-menopause stage. Now let's see the procedure. So it's very simple. First of all, you need to take the blood in gel tube, then you will centrifuge to get the serum, and then you will run it on an advanced machine, semi-automated machine like FineCare, Lofia, Digrade, or you can also perform this test on ELISA techniques. So by using these steps of the machine, it will generate a quantitative report. Now we have another test method, that is a direct, or we have ICT method, in which we take the urine sample from the pregnant woman, and then we will dip the strip, beta HCG strip. As you can see on the computer screen, this is the beta HCG strip. So this is the beta HCG strip. Dip the beta HCG strip, and then after that this will be the result. So if you got this result, so 1 band, so it means it is negative. So if you got this result 2 bands, it means it is positive. So it can indicate the quality. Now let's see the main causes of high HCG. This is again AFP, it is not AFP, HCG. So the main causes of high AFP is ectopic pregnancy, breast, placenta, testicular, lungs, ovarian cancer, uterine GIT carcinoma, melanoma, alcohol and smoking, duodenal ulcer, liver cirrhosis, radiation therapy, Crohn's disease. So these are the main cause of high HCG. Now let me share some important points to you, that remember guys, what will happen, sometime the beta HCG value will reach to 4 lakh. So when it is reached to 4 lakh, it means that the treatment will be failed and the treatment will be not workable. Next point, when the surgery is performed and when the tumor is removed using surgery, so then it is expected that the beta HCG value will be declined. Next we have that sometime what will happen, there will be slow, or the beta HCG level will be decreases sometime. It means that still the cancer is present. Sometime when the chemotherapy process is done, then on weekly the beta HCG test should be performed to check the measurement of the beta HCG level. So dear viewer, this is all about the beta HCG test. Thank you so much for watching. If you like this video, make sure to hit the like button, share this video and subscribe the channel to get more interesting videos like that.